in this with two successful clinics, and also she is the principal of an academy in the UK as well. So for for the participants who are based in the UK, you're more than welcome to contact us or Dr. Jin if you need any local training or courses in the Academy of the UK. I'm sure she's the best to contact. Also, please note that session will be recorded and the link will be shared with you if Dr. Jin gives the permission afterwards. And no confidential information will be shared in this webinar. All speakers express their personal views and opinions, and this is not necessarily the official incoherent opinion. Please make sure all the participants in mute mode while the lecture is on. There will be question and answer time after Dr. Jin finishes the lecture. And now we have Dr. Jin proceed the lecture. The stage is all yours, Dr. Jin.
Thank you. Thank you, Kelsey. Hello, everyone. Hello, I'm Dr. Jin. I'm Nan. It's such a privilege to be here, share my experience in combining energy-based devices into my two clinics. And I'm just here to share my experience and hopefully we can learn from each other. And truly that has increased my profit and made my clinics a lot more successful than they were before. So let's get started. Can you see my share screen? Sorry, Kelsey, I think you have to stop sharing yours.
Okay. And I think you can share.
Wouldn't let me share, saying that the other participant is sharing, so I can't share.
Try now.
Let's have a look. Sorry, I keep saying you cannot start screen share while the other participant is sharing. Let me have a look. You're viewing Lara's screen.
Okay.
Look. Always happens, isn't it?
Yeah, I think it's now it's working with door one.
Is it better?
Yes.
Okay. Is it full
I think is sharing, and we have about 2 minutes to go.
Okay, that's fine.
So
let me have a look what's on here.
Yeah, I think we start to have more participants joining us.
Hold on.
We have Albana. We have Bart from Holland. How are you, Bart? And we have Rada. We have Jordana. And we have Anna. We have Jurgen. We have Ruth. We have Natasha. And yeah, as yes. And I think more and more participants will be joining us. We have 1 minute to go, and because the participants today, they are from like pretty much different time zones, different countries, but they all want to hear about your lecture today. And we know a lot of them, they have been either working with us for quite some time, but they really want to know about your experience, especially with how to incorporate the devices with their other treatments or other technologies, other products, and how to market the treatment plans, and how to increase the profit. And yeah,
I think that's
so now we
game,
have
isn't it?
yes.
So
So
it's really
the lecture is very important and very informative and helpful, which I'm sure.
Okay, we'll learn from each other, don't we? We're always learning. So I see this as an opportunity for me to share my experience to everyone. Yeah, hopefully it will be helpful to everybody.
I'm sure it will
okay.
be. And hi, Albana from Switzerland. Welcome. Okay, so now we have the time with Dr. Jin.
Okay, lovely. Shall I make a start? Start properly. Hello, everybody across the world.
Please. Yes, please.
Okay, I'm so excited to have I'm so excited to have you join me today. It's really a kind of like a learning experience for me to share with everybody. It's just to share my experience as a business owner. How did I start to introduce energy-based devices into my own clinics, and how that helped my clinic and business grow. And it's just me to share my own experience, and hopefully it would help you. Okay, I do feel really privileged to be here. So how to enhance your aesthetic business by incorporating energy-based devices. Let's get started. So why do we choose energy-based devices? There's a huge market behind energy-based devices. It was valued at 4.1 billion last year and is projected to triple the value in about 10 years. And how much of a share do you and me are actually in it? Combining the energy-based devices with injectables have been practiced successfully in the medical fields for many, many years, and so much more in the last 10 years, I would say, many successful aesthetic clinics. And I think a lot more become more noticeable with celebrities, and they have a lot more energy-based devices treatments. So people are more aware of it. Another thing is aging is multi-layered. It is not just a simple, your cheek is flattened, you lost your fat pad, or your lip is lost the volume, or a bit of wrinkle. I think to just treating one area, it is the past now. Really, if you want to achieve the best aesthetic treatments to deliver the best aesthetic results, you got to treat multiple areas and address in different layers. So is that the reason why it's so important to combining the treatment with multiple modalities, that including energy-based devices. And a lot of people are more aware of energy-based devices treatments, and they're actually asking for it. So be ready for your clinics. Next one. So why do we choose energy-based devices? It's like if you got a toolbox, you got to have different tools. The more tools you have, the more treatment options you can offer. And the more treatment options you can offer, the more profit you will have. So, and also it opens up a new client base who previously are very biased and been very resistant to aesthetic treatment because of the needles or knives. Nobody likes pain. Some energy-based devices give the options to give the treatments that can just overcome that barrier and attracts new clients coming in. And actually, really importantly, especially my own own personal experience, I feel energy-based devices actually, when you combine in the right sequence with injectables, they actually enhance and complement each other. They make each other work better and more powerful. You notice results better, faster, and the results enhanced. And also, energy-based devices give you very natural results. It's very difficult to give you fake results with energy-based treatments. And they give you a very good profit margin and return of investment, especially if you have people working for you. Because a lot more energy-based devices now, in the last 10 or 20 years, the technology have evolved so quickly. They're actually really safe. If you have proper training, you can delegate those tasks to other people to do the treatment for you. And then you can free up the time and your space, and you can generate a lot of profit in return. So looking natural is, I would say, the number one design in the last 5 years. You can see in the celebrities, you can see the press, more and more famous people have their lips dissolved, and they want to look natural. And a lot of my clients don't want to look fake. The first thing they want to say is, I don't want to look fake, I want to look natural. So looking naturally and naturally beautiful is probably the driving force behind a huge market of the innovative treatments, including biostimulators such as PLLA, calcium hydroxyapatite, and the stem cells, growth factor, etc. And energy-based devices are the perfect tool to achieve this really natural rejuvenation results. And you can attract clients who previously completely no to aesthetics, because they think the aesthetics injections going to make them look very fake. So here is one everybody probably knows. Simon Cowell was very famous. I personally think he was very handsome, but somehow he had a quite revolutionary change in his aesthetics, and he did look for a face very overfilled with fillers, and he actually had them dissolved, and he looks a lot better now. And there's another one, everybody will recognize her. I don't know, it went a bit too far. I think these are very important to be aware of, because these are the things that your clients see every day in, day out, and they don't want to look like them, because these are producing negative image and the stigma for aesthetics, and make a lot of clients very rejected to aesthetic treatments. So if you say energy-based devices are actually producing natural enhancement, that is going to open up a new client base for you. So where do I start? For people who are still new to energy-based devices market, I think it's really important to do your research, only invest in technology. You know that's definitely going to be effective. It has to make sense to your practice. It has to be tailored to your need. So if you have clients mainly more mature age, like 40 plus, then I think start with IPL or CO2 is probably good options to go for, because they are more targeted to mature skin and mature clients. And it's extremely important to get your skin sourced from a reputable company. Also, there is things about, shall I invest in the machine that can do different things, or is it better just to do one thing at a time? I think it really depends on your clinic. If you have got a few people works for you, invest in a machine that does multiple things might not necessarily be the best option, because you can't free up the machine when it is in use. Also, more expensive machine does not necessarily mean it's better quality. However, I wouldn't go for the cheapest one. The price is important, but it shouldn't be your determining point for to determine which machine you're trying to get. I think the number one for me is always after sales service, and it has to be ongoing support with marketing, training, and technical support. And eventually, really, the end is you're able to establish a good partnership with a machine supplier, because you should really profit each other, and it is ongoing partnership for me. I would suggest, if you haven't started yet, the 3 good machines to start with are IPL, radio frequency with or without microneedling, and CO2 skin resurfacing laser. So IPL is not a laser. It uses lights. I'm not here to lecturing everybody about what different machines doing. It's really just a brief introduction of main functions of them. So I'm going to go through them very quickly. IPL is very effective in addressing age-related changes of skin, and it's great for pigmentation and telangiectasia, such as rosacea, hot flushes, and it has a very low incidence of post-treatment hyperpigmentation in darker skin type compared with laser treatment. So combining IPL and laser are actually being practiced in a few studies. In one of the studies, this is treating the neck area in the population 28 trans women with an average age of over 50, combining IPL with ablative fractional CO2 laser treatment on the skin, of the neck skin. IPL showed significantly increased skin elasticity, reduced skin wrinkles, improved skin texture. However, there is not a lot of study done about IPL in combining with other range of treatments for necks. I have done a few in my clinics, but I think one of the cases I'm going to talk about later might share with you about that experience. So the next one is radio frequency. Radio frequency is relatively very minimum or non-invasive and extremely versatile, and is relatively safe on darker skin. It works by tightens the skin and improve overall skin tones and texture, and it's great for mild to moderate skin elasticity. It uses heat to apply to the skin to stimulate the generation of new collagen and elastin, and it is different to laser because it doesn't target the melanocyte in the epidermal layer, so the risks for it to cause hyperpigmentation after treatment is relatively low. So that's why it's quite versatile, can be used in a darker skin. It usually require multiple sessions. Microneedling is probably one of the most commonly used non-conventional treatments in the aesthetic clinics, and usually are used in combination with other treatments such as serums, PRPs, and chemical peels. It works by delivery controlled injury, and then stimulate growth factors causing new vascularization and collagen generation. And then it results in tissue remodeling, which usually happens in the subsequent 18 months. And when you combine radio frequency microneedling with injectables in here, such as biostimulators, there are some studies done about these combinational treatments, and they have shown that the combination treatment is an effective, very powerful treatment for marked skin damage, including stretch marks. Stretch marks are very common concerns in certainly in my client group. A lot of them are due to rapid weight loss or had been pregnant and had childbirth, and it's actually really difficult to treat with other conventional aesthetic treatment. Not anymore, since I brought in the radiofrequency microneedling, and can be very effectively treated. So this is not my patient, and this is a study and publication done by Dr. Joe Many, was published in May 2023. And this is a patient had 3 sessions of microneedling. and after 6 months after giving birth. And you can see a marked improvement in the skin elasticity, texture, and the stretch marks. And so that is quite remarkable. So next one I'm talking about is CO2 laser. I think this is one of my favorite in the way that it does give you a very fast results and noticeable results. And there are different types of CO2 laser. There's ablative, there's non-ablative, and there's fractional. And it's been said is a gold standard treatment practiced in medical field in the last 20, 30 years, mainly plastic walls or dermatology, treating various skin conditions, mainly pigmentation, scarrings, wrinkles. I use heat to stimulate collagen production. And I would say for us as medical aesthetics in a non-hospital based environment, I would go for the best option I would suggest is the ablative but fractional CO2 laser, because it combines it give you better results than the non-ablative CO2 laser, but the downtime and the side effects are much less than the full ablative CO2 laser. So this is the difference between the three different models of CO2 laser. You can see the ablative resurfacing. Fully ablative means that, you know, taken the top layer of the skin off, and from that you can see the risk of pigmentations and scarring can be quite high. So you got to be quite careful, especially with people with risk of keloid scars or darker skin types from 4 to 6. The non-ablative fractional resurfacing is the ones, the other extreme. You can see the top layer of skin is protected, but it does go up deeper into the skin dermis and stimulate collagen production. And then the ablative fractional resurfacing, kind of a bit of both, and that's the ones I have got. And it does a bit of both. So the results is better than the non-ablative, but the risks of hyperpigmentation scarring is less than the fully ablative one. So I'm going to share with you a few case studies that these are all my patients, and with permission of them, I'm allowed to share their case with you. So there are a variety of age and ethnic background. Just give you a taste of, in my clinics, how I do the combined treatment together and how I feel it is the best way of approaching the modern aesthetic treatment. So the first one is a 38 years old female. I got no contraindications, no medical histories. I got multiple concerns, mainly fine lines, skin pigmentations, scar, pore sizes, the normal things you would expect in that kind of age group of female who want to look better for themselves. Skin type 3 tans very easily, want to look younger but natural. So we had 18 months of multimodality treatment plan, and time isn't an issue here. She'd rather have it done gradually but achieve the right results. So I had multiple treatments with your conventional treatment, your Botox, your toxins, fillers, with multiple areas in the face. We started a medical grade skincare to optimize skin conditions with the tretinoin and the hydroquinone to optimally suppress the pigmentation production in this lady, to reduce the risks of post-inflammatory pigmentation and side effects. And she had chemical peels, 3 sessions towards the end, just to give the skin a bit extra boost. She also had skin booster 3 times towards the about the 12, 13, 14 months. She had IPL twice at month 16 and 17, and at the end she had 1 sessions of ablative fractional CO2 laser. And a relatively low jewel, I think it's about 13, 14, because it's her first time, followed by stem cells skin booster immediately post CO2. and again for 7 days. And she had full claw spray to prevent infection for 7 days afterwards. So this is her before and after. You can see the marked increase in her skin pigmentation, and her skin looks much younger, more radiant, and there's no makeups. And she just looks fresher. She doesn't look fake. I think she does. So what is the outcome? So she had a minimum downtime of 3 days after post CO2 laser, which is remarkable. I mean, she is the first time she's had CO2. And she had a very naturally enhanced results, which hopefully were lasting. It's lasting results. And she had noticed the multiple areas of aesthetic concerns that has been improved. So this is her day 1. After day 0, immediately after CO2, you can see the skin's red, a bit inflamed. Day 1, a bit of flakiness of her skin. Day 2, much improved. Day 3, much better. So what I would like to talk about is 1-to-1 plus 3. Everyone knows 1-to-1 plus 2, but I say in aesthetic world, when you combine energy-based devices with conventional treatment, you really makes 1-to-1 plus 3 or even more. The reason for it is energy-based devices really enhance your injectables, and injectables makes the energy-based devices treatments much more powerful and reduce the side effects and downtime so much better. So for her, I believe the reason why she recovered so well and responded so well to a relatively low energy joules, it's only 13, is because her skin was ready, and she had her pigmentation very, very well suppressed, and she had stem cells immediately afterwards, which is boost her skin to recover. And overall results, when you combine the right treatments together, is intensified, and is really cost effective for the clients, because imagine the results if having them separately is going to be less than you actually combine them together appropriately. The learning point for this case is not everyone want quick results. Some are quite happy to take time to get the right look, and it is really, for most of my patients, I always tell them it's a journey, because it doesn't take one day for you to become to age. It's the best way of doing it is taking the right steps and doing gradually and doing it right to achieving the right aesthetic outcome. It's a journey. It's not just a simple a couple of appointments, do your lips and do your cheeks. And the gradual approach over a period of time actually will build up your client's confidence and your rapport with them. And you have a good relationship, and then we encourage them to have more and more treatments with you in the future. So the next case is a 34-year-old lady. She's getting married in 6 months' time. So she came to me saying, panicking, I've got wrinkles, I've got loads of pigmentation, look really ragged. She had kids and she has got sensitive skin. Apart from that, she doesn't have any other contraindications. But she hasn't got a lot of money left because she's got expensive wedding to pay. She had lip fillers years ago, but there's no other previous aesthetic treatment. So we sit down, we had a treatment plan. So it's a tailored 6 months multi-modality treatment plan again. The good thing for her as well as for me is because we are able to do it the combination treatment over 6 months time, that we're able to spread the cost over 6 months, which allow her to budget and pay for all the treatments she want to have, which is great incentives for her as well as for me. Because I don't think, looking back, if you say these are the treatments you got to pay upfront once or twice or 3 times, and I don't think she would be able to do it. So for her, we started, number one, always for me, is get her skin ready. So medical grade skincare, got her skin ready. Neurotoxin injections in month 0 and month 4 for her wrinkles. Had skin booster month 1, 2, 3. Had full facial filler treatments in month 1. and reviewed at month 3 to just tweak it. So she had multiple treatment again from forehead, temple, nose, lips, cheeks, jawline, chin, tear troughs. I think that's the treatment she had. She had about 8 mils of filler for her face. She didn't have, she had a Nan Jin plasma at month 5. She only had 1 session because we didn't want to do another one too close to her wedding. And I did, because she got sensitive skin, I was being very cautious with her. After the treatment, she had near-infrared red light therapy to aid her skin healing and to promote collagen production. And she also followed by Thawcloth spray 7 days to prevent infection. So this is her. So this is before and after. So I have to say, she did not, the second picture, she had no foundations. So that is her natural skin. She said she had some mascara on her face, on her eyelashes, and she had a bit of a concealer, a couple concealers on her face, but just a couple tiny spots because she was having acne, having a bit of breakout on that time. But she had no foundations. You can see it's a marked improvement. She just looks much better and fresher and ready to get married. So outcomes, we become really good friends because of all the regular appointments we had. We end up seeing her probably every 2 weeks for all the treatments. And I was actually invited to her wedding. I couldn't go because I was on holiday. But she looked stunning. And a lot of people commented she looked like a movie star. She was over the moon with the results. And she said to me, her mom didn't even notice. She had done gradually over the period of 6 months because it looked so natural. She was so worried that she's going to look fake. And now her mom is my new loyal client who just had her lip fillers done last month, which she swore she was never going to have it in her life, and she had it done. And her mom 2 days ago brought her other daughter came to see me for her daughter's acne treatment, and we're going to start her daughter on IPL. And now her mom's also having her skin treated with energy-based device treatments for IPL. Her mom had 2 treatments already, and she's going to have it ongoing for the next few months. And she's also booked in for skin booster, chemical peels, and she very interested in CO2 laser and HIFU in January. And this client who got married is booking her husband in with me next for his tear trough. So you can see that one client, your existing client is going to be your best assets. If you concentrate on the quality and establish a good relationship with them, you're going to have lots of clients coming into your door. So learning point for her is incorporating energy-based devices into your injectables really attracts clients who wants natural look. And treatment plan actually means the clients have the options to pay over a period of time, which is a great incentives for both of you. Combining energy-based devices would be able to help you achieve the aesthetic outcome much faster in a shorter time. So the next case study is a 65-year-old man. The first thing he said to me is that I just hate being old. That's all he said. I said, what do you want to change? I hate being old. And then when I just try to elaborate it a bit better, and his main concern is his scarring on his chin. He had a lot of other treatment with me, but for this case study, I'm just going to focus on his chin. So there's no contraindications, and he doesn't like needles. He wants treatment that produce quick results. It's like a typical man, no patience. So we decided the quickest way of achieving the results he wanted, probably the CO2 laser, because he had quite marked pits and scarring on his chin. So we decided combining CO2 laser and a filler, which has been shown in the study, evidence suggests it's incredibly effective in managing post-surgical scarring. And there's also evidence suggesting that combining microneedling with radiofrequency could potentiate the results by improving the regeneration and rejuvenation of the skin. So for him, we had a 6 weeks treatment plan because he is very eager to get it done and done it quick. So eventually we managed to get 6 weeks out of him. So it's multimodality approach again. So I got him on the skincare regime to optimize skin condition. I have to be honest with you, he didn't stick with it because he said it's just too complicated for him. There's only 3 products, but he can't do it. So he didn't use that very much. He had a neurotoxins and fillers on the chin and peroral area. He had skin boosters at month 0 and 4, week 0 and 4, and followed by CO2 laser at week 6. Again, I applied the one-off stem cell skin booster immediately post procedure, followed by Furclow spray daily for 7 days. He had 4 days of mild red itching peeling, and there's no other complications. So this is him before and after. You can see after 1 treatment of CO2, it is a marked improvement in skin texture, and he was very happy with outcome. And to be surprised, he's going to come back for regular IPL, and also he because of the relationship we established, because of the trust throughout a few treatments we had, and he agreed to have his tear trough done because his tear trough's crying out for some attention. But he was very resistant to start with, eventually, because he trusted me now, and he wants to have it done, which I taken as a compliment. And he might even consider another session of CO2 in January. So I've got a last case, I call it a tricky neck, because I don't know about your clinic, but in my clinic, a lot of my clients in 40 or 50, 60, 70s, they were spending money and creams and things, treatment on their face, and suddenly 5-10 years later, their noted necks got really wrinkly and been neglected, and this massive contrast made the neck looking even more aging. So they come to me saying, oh my God, I need to do something about my neck. And with a conventional aesthetic treatment, it's actually really, really challenging to treat necks because there's limited roles for aesthetic neurotoxins or fillers. So I would like to share with you with this case because it's very enlightening in my opinion. So it's a 52-year-old lady, had a Botox in the past. She had many concerns, but for this case, her main concerns about saggy and wrinkly neck. She's on taking HRT, no other medical conditions or contraindications. It took her a while to agree to have CO2 laser because she was very worried about downtime. And she read a lot, she worries about a lot as well. She also doesn't want to have a fake look. So we had a 6 weeks treatment plan for her neck. So start again. I always get the skin preparation ready, make sure that I think this is foundation to minimize their side effects and downtime. We had 2 sessions, skin boosters at week 0 and 4 weeks. Had neurotoxins at week 3 and CO2 laser, which is ablative fractional CO2 laser at week 6 with immediate stem cell booster post procedure. Had followed by 3 daily application of stem cells and Furclow spray for 7 days. So this is her 2 weeks post CO2, and you can see the difference is remarkable. She was over the moon with her results. She texted me. She said, thank you, Nan. My neck has never looked so good in 50 years. And in fact, she said she never think my neck can ever look so good. So she's very, very happy with her necks. So as I said, there's a lot of people more concerned about their neck now, and evidence suggesting combining energy-based devices with conventional methods are safe and effective methods of treating aging neck. And this is not just my personal experience. If you look at literatures, there are quite a few studies done about combining energy-based devices with conventional treatments on neck area, and the results are quite convincing. So for her, the next steps are the patient would like to start on HIFU for her saggy jawlines. And she also wants to start on IPL and fat dissolving injections for her thigh. So learning points for her is she was initially very put off and worried about the downtime side effects for CO2. But I think the skin boosters and able to combining the energy-based treatments with other injectables really reduce the side effect and minimize the downtime actually really boosted her confidence. And you can see that she's ready for her new adventure with a lot more energy-based treatments. So there are safety and cautious about combining different treatments together. And I think the number one rule is you must know your anatomy. You know your anatomy steps and layers of your muscles, your skins, knowing which injections or what treatments worked on which layers of your skin. There isn't any strong evidence out there to give you clear guidelines on how to safely combine energy-based devices with injectables. And a lot of the knowledge is really from the last 20 years of practice, the 12 era. There's many different opinions from extremely relaxed about it, and there was some literature saying you can combine all the treatment doing one setting. There's no evidence why energy-based devices destabilize your fillers and neurotoxins. However, for me, because of lack of clear evidence guidance, I'd rather do it more cautiously. So I looked at other literature. So they're saying that if I would rather stages these treatments if I have energy-based treatments combined with fillers, especially if the fillers are deeper or in the same layer of the skin where I'm going to use energy-based devices to treat. For neurotoxins, when you're combining energy-based devices with both neurotoxins treatment, I think there was some when you're having injections. So after you have energy-based treatments, you usually would have a little bit of swelling, and that's just post-treatment swelling, and that's to be expected. And the swelling would fundamentally affecting the diffusion of the neurotoxins. And for me, that would somehow affect the neurotoxins absorptions and uptake by the muscles. I would rather kind of having these treatments separately. And also swelling may also change an anatomical landmark. So where you're aiming at the muscles, it might not be as accurate after the swelling. So I usually suggest treat with energy-based devices first, allow the tissue to cool down and swelling to go away, then treat with neurotoxins. In terms of biostimulators, which is a relatively new thing coming to the market, I use a lot of biostimulators in the last 2 to 3 months now, and it's been very hugely popular in my clinics. But there isn't any clear studies on how to combine biostimulators with energy-based devices. So what I usually do is I usually would do the energy-based devices treatments first, wait for the tissue to recover. Usually we're saying about 2 to 3 weeks, depends what treatment you're having, and then we'll do the biostimulators afterwards. So in a conclusion, I would say combining energy-based devices into your aesthetic business will definitely make your patient happier if you guide them and consent them and explain to them correctly, and that would definitely help you more profit and help your business grow. And it will enhance your patient satisfaction and makes the aesthetic results much faster and much more intensified. Before you buy any machines, if you haven't got anything in your clinic already, do your research on your market of your client's base. What some machines right for your clinic, and choose your machine source carefully. I got most of my machines. I've got quite a few, but 3 or 4 are from Cosingheren, and I have to say their after sale support is been remarkable. And keep up to date with your training and be safe. And we are all still learning on this area about combining energy-based treatments with your normal conventional injectables. But don't let that put you off, because for aesthetics is a fast-moving world and is ever changing every week or months. And if you don't stay on top of your game, out. So that's my reference, which is a lot. So if you need any more details about reference, which study you want, you can always email me or email Emily or Kelsey, and I will get back to you. And thanks for listening. And I hope it's been helpful. And I'm ready and welcoming questions.
Thank you so much, Dr. Jin. I see there are already participants who couldn't wait to ask you some questions. And now we have the Q&A time, and I'll leave more of the precious time for you and our other participants who have questions. And well, we already have 2 questions for you. One is from Anna. The question is, what preparation would you recommend prior to HIFU?
Okay, so HIFU, I think
this is the first question. Yes.
Yeah. So I think it depends what your yeah. Okay. So I think it really depends on what your it depends on a lot of factors. It depends on your client's age, client skin type. I think HIFU, for me, I always just if there's any risks of causing inflammation of the skin, and their skin type is slightly like 3 or onwards, as in there's risks of hyperpigmentation, I would always make sure they are on a skin preparation or skincare regime that has got pigment suppression in it. So I mainly use 2 things: retinol and hydroquinone. I always start retinol 7 days before any of the energy-based treatments, just because it's such an active and powerful treatment. But it is, for me, it really does speed up the skin recovery, and it makes the skin much receptible to treatment from the energy-based treatment. And the hydroquinone, for me, it is such a great way of using it, because your risks of hyperpigmentation after treatment suddenly become a lot less. So you could just go with a little bit of extra you can use a bit more powerful treatments, because your clients are going to be able to take that, and afterwards the risks for them, the skin to have hyperpigmentation is much less. So that's for me. And if their financial situation allow, you'll be surprised how much more they're willing to spend than they say they originally was going to spend. I mean, all this treatment to start with, their clients, they only got this much, but actually when you speak to them about how they actually work together and make the other treatment better, you'll get more results if you have this together. They are very open to spend a bit more, but then to have much better results. That's why my theory is 1 + 1 is equals 3. You're selling them as a package. And all my clients come in just want 1 treatment. They all goes with 10 or 12 treatments, because you make them understand. You get their thinking is you get more buck for your money. So for them, if you telling them that having skin booster, at least 2 sessions, 4 weeks in between, at least I'll say 2 weeks before HIFU or CO2, would enhance your ability to actually respond to the energy-based treatments, and your effect is going to be much better. that probably would also enhance the treatment much better. And there is different type of skin boosters. I use different skin boosters, such as the biostimulators or the normal HA skin booster. It depends your client's skin type, how old they are. But yes, there's another opportunity for you to sell another treatment, but also your client benefit from it too.
Thank you so much, Dr. Jin. You did also answer the other question about the skin booster. And now we have another question from Michelle. Which product and treatment do you recommend for deep scars like keloid? That's the
Keloid,
question
I'll be
from Michelle.
very cautious. Yeah, keloid. The problem about keloid is they are hypertrophic scars. So the more you dig, the more it comes out. I would, if I'm you, unless you are a plastic surgeon or very, very experienced in dealing with keloid, I would say no treatment unless under specialist doctor. It just because for keloid, it is scarring. So the more you do, the more it comes out. So you end up going to have a very complicated patients keep coming back. And I think for me, I would say no from my treatment. I would actually recommend the patient to go to seek specialist help. From a doctor's point of view, because obviously I work as an NHS doctor as well. Keloid treatments are usually treated by dermatology or plastic. They usually use injections, steroid injections, and that's not allowed in aesthetic clinic unless if you are CQC registered or regulated by the regulation body, because that's a treatment. So certainly for aesthetic clinics, I wouldn't recommend you treating keloid. That's my answer.
I hope that answered your question, Michelle. And does anyone else, we have another question from Precious White. Can you microneedle before using an IPL? Can you
I'm sure you can. The thing
before IPL?
I mean, you mean how immediately before? I wouldn't. The thing is, I think you are combining two treatments together very closely together. I would avoiding the side effects and avoiding the downtime. I wouldn't personally do that. I would just probably microneedling. I'll probably stage it about a week, at least maybe 2. It depends your skin, how your client's skin's reacting to microneedling. But as I said, we're still learning. A lot of it's from trial and error, and there isn't any clear guidelines. But personally, I would not do microneedling before IPL, not immediately before.
Thank you, Dr. Jin. And another question, can after HIFU, and how often you can do HIFU after 40? Was that the from Ghana? Would you mind further explain about the question? Are you still online, Dragana? Or we have Helen asking, can you talk about rosacea?
Yeah, I can talk about rosacea. It's fine. So for HIFU, I think after 40, it really depends. First of all, so I'll answer 2 questions about HIFU. How often can you have HIFU after 40? Really, it's like similar as IPL. I mean, I don't think there's a clear guidelines how often is too much or how much is too much. A lot of it is regulated or limited by your client's financial ability. But if your clients, have the money and time is not the issue, I think after you're probably going to have at least 3 or 4 HIFU sessions, and maybe 6 to achieve the optimal results. And afterwards, I will usually recommend them to come every 6 months. But if they wanted to come more often, you could probably do every 6 to 12 weeks. It really depends what I would say the high for results would last for quite a while. I wouldn't think you need it for that often. I think because the way it works is, you tighten up the skin, and I wouldn't thought you need it more than every 3 monthly afterwards. In terms of rosacea, uh, so rosacea is a big topic. I can talk about rosacea all day. So rosacea is really, really common, especially in Caucasians more common, and actually the age, a lot of rosacea is actually hidden. Like, a lot of people don't really know about they got rosacea until, for me, I got a dermatology background, so you could actually tell, but it's common. And when you tell, especially younger clients in their 30s, early 40s, oh gosh, you got rosacea, they suddenly become really excited. It's like, oh my God, I got rosacea. What am I going to do? I don't want to look red when I'm older. But it's mainly how do I, in a nutshell, very briefly, rosacea is basically is a skin very, very sensitive, sensitive to light, sensitive to alcohol, sensitive to heat. You have flushing of your skin, and you have this telangiectasia, which is superficial blood vessels on your skin, and the treatment mainly is to photo protection, avoid triggers, and moisturizing using very mild product to avoid irritation, but then also using retinol, but slow and steady to build up the resistance of your skin. The really good thing about IPL is one of the things actually effectively treating rosacea, and you almost have results not immediately, but very, very quickly. We're talking about in about 1 or 2 weeks, and people say, "Oh, my skin's a lot less red now when I'm drinking a glass of wine or going to outside." The good thing about IPL and rosacea, a lot of people have rosacea in my clinic, is you're giving them multiple treatment, and this client never just go out of your door having one treatment or one modality. In my clinic, they also go out with a whole full skincare regime, which they comes back every monthly to get them. So that's my income, number one. They have regular IPL, which they can notice results straight away, number two. And they have skin booster, number three. And then on top of it, they would have filler, Botox, and things. And this regular contact, I build a really good rapport with them. And so the rosacea doesn't go away very quickly, which is good and bad. In a good and way is, for me, it keep coming back and have seen the improvement, but bad for the patient because it isn't a very effective treatment for rosacea. But the combination treatment is proven probably the most effective treatment you can have outside there. I'm happy to do a dermatology talk about rosacea another time if you want to. But it's a big topic talking about rosacea.
Definitely. We have about 8 minutes to go for today's lecture. So if anyone else has any questions, feel free to. We have Helen. Does IPL work for acne? About acne.
Yes.
We're very lucky today to have Dr. Jin.
Acne. Oh gosh, I love acne. The way acne is nightmare to treat, because acne patients come in miserable. They say, "Oh, my face is horrible. I'm breaking up every day," and affects from a range of people, from in their late teens to even 40s or 50s. People break out with acne, and these people come in with a combination of things. They're not just coming with acne. They'll have post-inflammatory redness, post-inflammatory pigmentation. They'll have acne scars. They will have active acne, comedones, blackheads. They will have oil imbalance. They will frequently come in with rosacea too. So you have perfect canvas to treat with multimodality treatment. I love this patient because really you can get your hands into them. So would IPL work for acne? Absolutely. IPL works brilliant for active acne, as well as the treatment, also as prevention. I have people come in for IPL for acne treatment regularly, and they notice the effect almost as rosacea very quickly. Even after one single session of IPL, they will notice the effect. Their acne a lot calmer. The good thing about IPL is you don't just give them IPL. When they come in with acne, you give them acne treatment, skin preparation. For me, it's different to other bits. So it's a whole skin care regime, which I will start them on. I usually start them on retinol. They would book in for a regular session IPL, usually 6 sessions or plus. And they will come back for regular review, and I will give them skin pills. So chemical skin pills. I usually do the Obagi Blue Pill Radiance, which has got it's 3 acid pills, which works great for blackheads, and they all again enhance each other. They all again works together and makes the results are just so much more powerful. And my clients, all of them coming back overjoyed because their skin just looks so much clearer. So yes, definitely work for acne. Yeah, again, acne is such a big topic, but acne, and another thing, if they're more mature skin, and when you're relatively happy, the acne is relatively calm after several sessions of IPL, and their skin is optimized by your skin regime and for pigmentation suppressions. With retinol and hydroquinone, then you can suggest CO2 on top afterwards. So that could be almost like your cherry on the top. So again, you have got perfect clients. You can sell them so many treatments, and if you guide them right, they will have them all. So this is the way that why combining treatments are so good, because one helps you to sell the other, and you get happier clients, and you end up raising your profit because you have so many different options.
Thank you so much, Dr. Jin. You're very generous. We have 4 minutes to go.
Okay.
And one last 2 questions. Can you let us know more about radio frequency? And another one, alopecia barbe treatment? Yeah. Sorry, your time.
So what's the other one? Sorry, what's the other question?
The other one, which pills you would choose? Which pill?
Which pills would choose? Chemical pill choose.
Yes, which pill you would choose?
Okay. So yeah. Okay. So I think what we're going to do is I'm going to talk about the pill radio frequency. I think it's probably a different seminar to talk about. So radio frequency, we're using different so targeting different layers of skin allows you to generate collagens and tightens up the skin. I think there's quite big topics to talk about. Probably we talk about in a different scenario, different seminar. But in terms of skin peel, I use quite a few different skin peels in my clinics. So it depends again on the client's skin types in terms of the lighter skins or darker skins. But for the sake of this seminar, for combining with energy-based treatments, I usually use a lighter peel just because I don't want to irritate their skin too much, that before I start them on the multimodality treatments, usually have a lot of other treatments together. But I usually use the Blue Obagi Pill Radiance, which has got 3 acids in it. So it's got glycolic acid, lactic acid, and got salicylic acid. And it's a really nice pill because it works for a variety of skin conditions. It works for acne, great for acne, and great for rosacea, great for just the normal kind of dull skin tone. And Obagi has been well known in the aesthetic world for ages. I mean, I'm not paid by Obagi, so I'm not really trying to say. I'm just saying that I've been using Obagi product for a while, and they've been very reliable. And the thing I choose Obagi Blue Pure Radiance is because you can use them on all sorts of skin types. So even skin type 6 or 5, you can use them safely because they don't go too deep to stimulate the pigmentation. And it is light enough that they don't have downtime. So for them, it's a very nice result immediately after the peel, and they feel their skin is more radiant, smoother, and the blackheads is gone. And the good thing about it is carry on working for the next 7 days to stimulate your collagen as well, so your skin continue to look great for 7 days. And that is very safe, very effective, a nice treatment for me to have just probably a week or 2 weeks before the energy-based treatments. And again, that goes with a lot of my client group as well. I mean, it works well for me because a lot of my clients are in their age group, but it's relatively more costly. So compared to other skin peel, I think Obagi ones is a little bit more expensive. So it depends what your clientele is. If they are in their 20s or 30s, you probably don't need to use a peel like this. You could just use like a simpler glycolytic skin peels that might be cheaper. So, but I've been using Obagi for a long time, so that's the ones I would recommend.
Thank you. And one last question about CO2 laser treatment for eyelids. Can you talk about CO2 laser for eyelids?
Okay, so eyelids are the top eyelids, really close eyelids, or it's just okay. So I'm just saying CO2 you can treat, as far as I know, you can treat very close to the eyes. Personally, I haven't done anything on the eyelids myself, I have to be honest with you. But I think you can treat very close to the eyes. I have gone very close to my clients' eyes to treat for their crow's feet, and that has been proven to be safe. And the skin around the eyes a lot thinner, so you got to be a bit more careful. I think you probably want to be cautious, just turn the energy level down a bit because you don't want to be too aggressive on the eye area. But as far as, because I can go very close to that, certainly on the lower eyelid as well. But another thing is you got to be quite careful about you don't burn the eyelashes. So sometimes you go too close to it, you probably be careful. Yes, it is generally. Personally, I haven't had experience treat very close to the upper eyelids. I had experience treating around the crow's feet and under the eyelids, very close to the eyes, and I had got quite good results for wrinkles and pigmentations, and just generally skin. The collagen productions are much better. Um, but again, another thing you got to think about is your post-inflammatory pigmentation risks and scarring. A lot of my skin preparations are not recommended to go very close to the eyes. So that's another thing you got to think. You probably have to treat it as a completely separate entity compared to the rest of your face. If your client haven't using hydroquinone around their eyes, you probably be very careful how much you're going to use, because you don't want to give them a pigmentation around their eyes after CO2 laser, especially if they have skin type 4 plus. So yes, you can, but be very careful. That would be the answer.
Okay. Thank you so much, Dr. Jin. And I think that's the last question for today, because now we're coming to 3:10. I mean, 3 minutes. 3 minutes after the lecture, but a lot of thanks from the question area. Okay. Once again, thanks for Dr. Jin and everyone who have been with us for today's lecture. And we will keep on providing informative and helpful lecture like today. And also please do get back to the account manager who has been helping you from Syncoherent for any other questions that you may have. And we'll keep in touch with Dr. Jin for helping us and together with the doctors from Syncoherent to help you with any other questions you may have. And also we will have a questionnaire after this lecture to follow up on you guys for the other topics or subjects you might be interested that you think is helpful, not only for you to use the devices, but also you think that's helpful for you how to be successful for your business, because we care not only about if you have the devices, but more if you can be successful with us. That's more important for us. So thanks thanks everyone for today, and that's for the lecture. Thanks again for Dr. Jin.
Thank you for having me. And, thank you, everybody. Thank you for listening.
Thank you so much.
Bye-bye then.
Bye-bye.
Bye.
Bye. Thank you, Anna. Okay. See you next time.